My name is Jennifer Danford. Like I said, I've had some of you in my classes before, so it's good to see you guys again, and welcome to the people who I have not had. Um, what I like to do is talk to foster parents or get some ideas for topics that would be helpful, and one of those topics was this one, ADHD. Um, which is totally understandable because a lot of our kids in our homes have diagnoses, ADHD being one of the more common ones. And with ADHD comes a lot of behaviors. So I went to go ahead and say I was going to do this presentation. And then about a month ago, I started doing some research on it and learned a lot of things. So hopefully this will be helpful to you. I have a nephew and a niece who have ADHD, as well as some siblings. So this has been really helpful for me in learning how to better address some of their needs. And that's really what I want when I do these presentations, to find something that will help you guys lessen the stress in your home, help things be more successful for you guys when you do parent some of these kids who have harder diagnoses. ADHD is common, but that doesn't mean it's easy. So hopefully that's what we can get out of this. So I'll just kind of say where we're going here. I haven't done this presentation yet with anyone, so I don't know like how we'll end up. Hopefully time-wise we'll be fine. It's really just a lot of facts and a couple of short videos, but so really I'm just going to give you the basic information on ADHD. Some of you may be beyond that, but it'll be a review, symptoms, those kind of things. We'll talk a little bit about what the effects has on the brain and why kids who have ADHD's brains are a little bit different and how that looks day to day. And then I do have some interventions in here, which is really what I think will help you guys the most. Talking about school interventions, home interventions, community interventions. I also have a really cool resource that I found helpful. It's a book, and I will talk about that a little bit as well. So actually, this is from the book. It's just interesting to me that it says ADHD is not a recent discovery. In one form or another, it has been recognized in North America since 1902. Its present pharmacologic treatment with psychostimulants was pioneered more than 6 decades ago. And this is from that book I'm going to talk about. So this isn't like, although it's been more popular and more diagnosed in the last, oh gosh, probably 20 years, 30 years, it's been around for a really long time, and talked about, and they've used medication to deal with it. So something to think about. So just some basic facts about ADHD. It's really one of the most common neurodevelopmental disorders diagnosed in childhood, although the symptoms do continue. So typically in a normal like home, this disorder becomes apparent in children between 3 to 5 years old. But if you have kids coming into your guys' homes, it may not get diagnosed. Also, kids can compensate for some of the symptoms they have, and so maybe it may not get diagnosed till later. 5 to 10% of school-age children have this diagnosis. So out of these kids, 65% will continue to experience symptoms of ADHD into adulthood, which makes it a lifespan disorder. So yeah, we need to kind of work on how we address this disorder, because some of these symptoms will continue on into adulthood. So again, just kind of getting into the basics of it, there are 3 principal characteristics: inattention, hyperactivity, and impulsivity, which, to be fair, we do see these characteristics in a lot of our foster kids. Some of them have ADHD and some of them don't. Um, so I think you guys are you pretty well know what these look like, but hyperactivity, I mean, inattention is pretty self-explanatory. Hyperactivity is just anything that's their motor activity is just um, higher level, especially when it's not appropriate, it's excessive. And then impulsivity, just any kind of decision without forethought. So the way they diagnose is through this DSM is what they call it, which is essentially the book that therapists, psychiatrists use to um, make diagnoses. So I didn't go into a lot of it, but according to the DSM, there's two patterns of behavior in ADHD. One is inattention and the other one is hyperactivity, impulsivity. I'll talk about those two types, but I'm not going to get into like the differences in DSM diagnoses, but I did include some links if you're interested. So kids can have one pattern or they can show a combination of both. It's not always just one. So I'm going to talk about both patterns though. And the first one is this predominantly inattentive pattern. So this one's interesting. So this is when we talk about DSM, majority of the symptoms are in the inattention category. So the DSM lists out like, these symptoms, and they have to have so many in certain categories. So if you're interested, there's a link and I'll have it in my references as well. Or you can just do a search on Google, like DSM characteristics for ADHD. So they have to have 6 or more in this inattention category, but less than 6 in the hyperactivity. So what does this look like? Inattentive type ADHD is a little bit less noticeable in the beginning, but it has its challenges for sure. So kids like who have this are less likely to act out. They're less likely to get into issues with other kids, but they daydream more often. They space out or kind of are confused. They struggle probably with school a little bit because they have trouble processing information quickly and accurately. Because they act out less, they can be overlooked or remained undiagnosed. If they're doing something they like or enjoy, they don't have any trouble paying attention. And we'll talk about this later because it's one of the more frustrating symptoms of ADHD. And then homework is really hard for these kids. So a couple other things, they may struggle to pay attention to details or make careless mistakes, even though they know what they're doing. They make these careless mistakes, which can be very frustrating. They may know their timetables. They do a whole sheet and they mess up 7 times, and you're like, I know you know this, because they're spacing out. Trouble staying on task, you ask them to go clean their room. This is the kind of kid that then you go check on them and they're playing with something. They just can't stay on task. May appear not to listen, may appear not to follow through on directives. They struggle a lot with organization. They may avoid or dislike tasks that require sustained mental effort. So anything that they really have to think about or learn, things like that, especially if they're not interested. They lose things necessary for activities. So the kid that you send to school with their gym clothes, and then they've lost like 7 pairs of gym clothes at school, and they just literally have no idea. And they get distracted easily. So if they sit by the window at school, you can kind of forget about them paying attention. And then they're very forgetful. So we'll kind of come back. But you can see how even though the inattentive may not be what we think about with ADHD, some of those symptoms can be very aggravating over time because you're not seeing the child live up to their full potential, and you're not understanding what's going on. So this is the one we kind of think about, the predominantly hyperactive impulsive. Again, it's the DSM requires a certain amount of symptoms from the hyperactive category, and they can have some inattention ones, but less than 6. If you're interested, definitely you can Google it and it'll just pull it up. Buying a DSM is fairly expensive. So, okay, so some of these symptoms, always on the go. These are the kids running around, may talk incessantly. Gosh, it might take them like 10 minutes to tell a story about finding something in the backyard. Sitting still at dinner or at school is really difficult, like just walking around their chair, climbing up on their chair, rocking, those kind of things, squirming, fidgeting, struggling to curb their immediate reactions before they act, so just super impulsive, so impatient and blurt out at inappropriate moments, display their emotions without restraint or act without regard for later consequences. Like even if you tell them, like today, I'm actually in Colorado with my sister and her kids, and one of her kids has ADHD, and they just can't. So the consequence is video games and TV time, and it's like he knows he's going to lose that consequence, but he can't stop himself from doing the behavior. And he's a smart kid, good kid, great kid. But his impulsivity is just bigger than understanding that later consequence. And he's an older kid. So some other symptoms: leave seat in situations when remaining seated is expected, runs and climbs where it's not appropriate. They can't play or take part in leisure activities quietly. Oh gosh, yeah, this one blurts out answers to questions. Even before the question's been completed at school, these kids interrupt a lot as well. Or like they're the kids sometimes who are you're trying to talk to someone and they're, mom, I need this or whatever. They really struggle with that social boundary. And then struggles to wait their turn. So playing games is really hard for these kids, board games, video games, anything like that. So to kind of move forward about the disorder itself, ADHD is often characterized by the inability to focus, but really it could be better described as the inability to shift attention appropriately. Talk a little bit more about that, but ADHD is diagnosed when essentially their symptoms begin to affect life, like their social skills, school performance, or behaviors in the home. So that's when you guys are reaching out and saying something's going on, excuse me, whether that's ADHD or something else, is when the symptoms are starting to get overwhelming. Excuse me. Okay, so again, with this like overarching theme of ADHD, there's a couple things. This hyper focusing thing that can also be really frustrating. So this is it involves this passive attention, like watching TV or video games. It's when our kids get hyper focused on something that does not involve a lot of brain power. But when we see it, we're thinking they can't focus on their homework. They can't focus on cleaning their room, the things we ask them to do. But yet this child can sit and watch, 8 hours of screen time. But the reason for that, part of it is it's passive attention, which allows the mind to cruise on automatic without requiring the brain to actually think. And if you think about this, like we can sometimes at the end of the day just put on a Netflix show because our brains have been thinking all day. it's really hard for kids with ADHD to organize thoughts, feelings, those kind of things. And so for them, this kind of stuff is very soothing for them. Um, on the other end of the spectrum, active attention is when we have to be doing things, right? Like working out math problems at school or figuring out where things go in our room, things like that when we're kids. And so this is when our mind is fully engaged. And for kids with ADHD, they utilize this in special circumstances where they're motivated. That's where we really see that. And so the brain really struggles with this. And this is where we're going to have to figure out how we can help with some motivation. So motivation and reward. So with ADHD, the mind is perpetual motion machine. And so there's an intense aversion to boredom. Even with the inattention one, the one that the child that spaces out, their mind is always thinking about things. And so they don't want to be bored. It's really hard for them to calm themselves down. And so that's kind of what's going on. And so there's also this push-pull between this restlessness and periods of procrastination, especially when kids start getting older, but even when they're younger, when they come to you and say, like, I have a project due tomorrow, it's a big diorama or whatever that's been due for like a week. Because that's not something they'd like to work on. So when we're thinking about reward and motivation, and I have some other information on this later, the threat of failure or the promise of reward has to be immediate for any motivation to be successful, because these kids really struggle with any sort of concept of long-term reward or anything like that. And so if you say tomorrow you can have this, it's just too much for them. So they struggle. So it has to be immediate. On the other side, when they want something, they don't have patience. They don't want to procrastinate. They need it like immediately. That's just how their brains work. So a couple of things about ADHD. One thing I learned just recently, not from this book, was about this whole thing about ADHD and time that really helped me. So this ADHD mind suffers from like this time illiteracy, which I've heard called time blindness. I don't know if you guys have heard about this. So sense of time it develops when we're kids. But for kids with ADHD, it's just really, really hard to teach them a sense of time. So even adults who have ADHD have time blindness. I have friends who have ADHD, and it's like they just don't have a concept of time. They're late all the time, or they get involved in a project and hours go by. So for a small child who hasn't learned time yet, 2 units really exist, right? Now and not now, because they don't know what later or anything is. Not now is like infinity. People with ADHD kind of still have this mindset. So some symptoms of time blindness, and I know kids don't know time, but I think you'll be able to see in ADHD kids, it's a little worse. Like things are harder, like getting ready for school, playing games too long, just things like that. So inaccurate time perception, like can't estimate time. Like it might take them a half hour to get ready in the morning when it should take 10 minutes. Frequently losing track of time, missing deadlines, postponing tasks, constant difficulties with time management. So a lot of things that can be really frustrating. Everyone in the car in 5 minutes, and then you've got this kid coming out 20 minutes later after 7 reminders. So here's a quick video about this.
I have to imagine that some of you watching this has a son or daughter who doesn't really have a sense of urgency, or they don't seem to mind if they're late, and they just don't have a great sense of time. Maybe they think that a task is going to take much longer than it should, or they might think it might take less time than it should, like a school project. Maybe they wait for the last minute for things. Well, here's why that is. People with ADHD experience time differently. There's a term for this called time blindness. I don't really like that term because I don't really think it describes what happens with kids. What really it is that they're just experiencing time differently. But the good news is we can teach them how to sense the passage of time. The strategies that you've probably learned from maybe an ADHD coach or in an executive function book or from a therapist, because this is the kind of thing that are in therapy treatment planners, those strategies, such as using a kitchen timer or the red countdown timer or a timer on a mobile phone or even digital clock, none of those things help you learn how to sense the passage of time. And here's why. The way we learn to sense the passage of time is through unit volume. Here's the example I always give. Think about maybe when you were in high school and you were in a class and you were really bored and you were staring up at the analog clock on the wall, waiting for the period to end, and you were just watching the big hand move very slowly. That's actually how you learn to experience time. That is seeing time in unit volume. So what we have to do is we have to teach kids what time looks like in unit volume. You cannot teach kids what time looks like in unit volume through a digital clock or a clock on the phone or a timer. The other thing with timers and that red countdown timer is when they stop, they stop. So what it's not showing you is how much time has passed. So for instance, if they were supposed to get off their video game at 8 o'clock and it's 8:10, well, if the timer stopped, there's no way for them to see that they've now passed 10 minutes and they've cut into their time for tomorrow. That's actually a strategy I teach parents in webinar 3 of Executive Function Crash Course, which is called Learning to Feel Time and Get Off Video Games Without a Fight. So if you want to help your son, I have to imagine.
Okay. He kind of talks more about his program. So I have another video with him. He does have some good information. Here's some other tips. So expand the now, not now thinking, constantly kind of reminding them of time, the recent past and the near future helps. Teaching the estimation skills. So making notes of the start and end times of something you do together, or discussing how long things take can help raise awareness and help teach them units of time. Using backwards design can help them problem solve time. So working backwards can be like, okay, so you have to be at school in the morning by 7:30. It takes you this long to get to the bus. So if it takes you 20 minutes to get to the bus, that's 7:10. If you want to eat breakfast, let's give you, 10 minutes to do that. So that takes you back to 7. If you want to take a shower. So kind of helping them build blocks of time to learn how to manage time can be helpful. And then showing kind of budget time, talking about creating like a cushion of 5 to 10 minutes so they're, on time or early. And then I know he talked about setting alarms not being helpful. I think if it's your only strategy, it's probably not helpful. But if you use it in conjunction with some of these other skills, it can definitely be helpful, especially with kids who are getting older, if they can start setting alarms for things like getting up or transition times, 10 minutes to go, those kind of things. Genetically, there is a genetic component for ADHD. There's genetic factors and non-genetic factors. So essentially, it's kind of like there is a possible gene for it, right? But that gene doesn't mean you're going to get it. It just means that it might be more likely if you have a certain set of circumstances that occurs with you. Kind of like maybe for um, if you have addiction that runs in your family. Not saying you're going to be an addict or have an addictive personality, but you should be careful, right? So same thing maybe with ADHD. There is an increased likelihood that parents, children, and siblings of those with ADHD will have the disorder. So that's why there's the possible genetic component. There's a lot of other overlap as well, though. ADHD is found with more commonly with people who have first degree relatives who are alcoholics, suffer from depression, anxiety, addiction, not addition, obsessive compulsive or Tourette's. So other kind of mental health disorders can be connected as well. There's some other factors. There's a positive correlation between prenatal tobacco exposure and ADHD, low birth weight, and trauma as well. So, again, not saying all these things create ADHD for sure, but there is more correlation. And we know for sure that our kids have at least suffered trauma. So that is something to be careful about. So, nope. Okay. So ADHD in the brain, there's a lot on this. So I didn't include like a ton on here, but there's some research that shows that the prefrontal cortex matures more slowly in kids who have ADHD. So our prefrontal cortex is really like our thinking part of the brain. This part of the brain is responsible for making decisions, being rational. Oh, actually have a thing that says what it does. It's involved in skills that include memory, emotional control, and complex problem solving. So those are behaviors and things that our kids with ADHD can struggle with. So they also found this collective network of structures in the brain that is unusually active with kids with ADHD. They call this the default mode network. And it's a part of our brain that's most active when we are daydreaming or our thoughts are wandering. So this is unusually active in kids with ADHD. So that kind of explains why they're offline sometimes. Like we're telling them, asking them to do things or whatever, and they are really struggling to hear us or do what we ask. So interesting to me that ADHD is often co-occurring with other disorders. Super common for our kids to have ADHD and also be dealing with something else. So kids with ADHD are 50% higher at risk for any sort of anxiety disorder, mood disorders as well. Also super interesting that kids with ADHD are more likely to have learning disorders. About 31 to 45% of kids with ADHD have one. Dyslexia being one. Dyscalculia is difficulty with math, and dysgraphia is difficulty with writing. I did talk with my sister a little bit this week, whose son is ADHD and he is dyslexic, and I did not know that. So, yeah, it's really common. So we also probably, if our kids have ADHD, need to make sure that we are evaluating them for other disorders to make sure that we're treating them for everything that they may have going on. Because if we're getting, frustrated with their inability to sit well at school or focus, and part of it is because they have a learning disorder, um, then we're not going to really get anywhere. So that's something to consider. Here's just a couple visuals to show what some of these co-occurring disorders look like. So anxiety and ADHD, so there's that inattention. That's kind of the link there. Anxiety is more inattention due to worry, but and ADHD is that external stimuli, but that inattention is kind of the link there. So autism spectrum disorder is often also a co-occurring disorder. We have inattention, social dysfunction, and tantrums in both of those. And so if you have maybe an idea that that is happening, it might be good to get them diagnosed. I am trying to get to more options. There we go. Chat, because I saw something. Okay. Yeah. So my ADHD brother has dyslexia, and they found these sheet overlays where every other line was highlighted. Yeah. So if you guys can't see in the chat, they have some newer things to help with dyslexia. I almost recommended that to my sister, but I don't know if she knows about that or not. But having something like that, a learning aid, would be really super helpful, but you wouldn't know about it if you didn't know that the learning disorder was there. So yeah, thank you for sharing that.
I would tell your sister about it because my brother didn't know how to read hardly at all until
Okay.
he was in fifth grade. And then once they started using those, he learned to read and got on level within 6 months.
Yeah, that's awesome. Because my other sister has a child who I think may struggle as well. So awesome. I will, and also I'll tell foster parents when I do these trainings. So yeah, thank you so much for sharing that. Um, Yeah, so sometimes those simple things can be really like super helpful, especially if you don't know what's going on and you're like, this child is just being willful. It turns out there might be something else going on, and there are things that can help. Yeah, so trauma and ADHD, this is tricky for us because our kids all have trauma, right? They have two traumas. One is whatever abuse or neglect that happened to them, and the second is actually being pulled from the home. And so trauma can present as ADHD, and trauma can also co-occur with ADHD. So it's really hard to figure out what's going on. You just need a really good assessment or team to work with them. The reason it can present as ADHD is because there's some overlap, like hypervigilance can look like emotional reactivity or dysregulation, which are ADHD symptoms. Distractibility happens in trauma, which also is a symptom of ADHD with like difficulty focusing. Impulsivity can happen in both. Dissociation can happen in trauma where the child kind of withdraws from the world, but that can really look like inattention. So it's really hard. We need to make sure we figure out what's going on. And then you throw in the trauma can co-occur with ADHD, which makes it a little more difficult. Oh, here's the similar symptoms that I was just talking about. Irritability and hyperarousal, which totally happens on our kids with ADHD, but that can be a response to trauma as well. So just making sure you have a good team. So 17% of kids with ADHD have 4 or more ACEs. I do some trainings on ACEs. Don't know if you guys know what those are, but essentially it's a way to quantify trauma. This stands for adverse childhood experiences, and they're literally it's a 10 question scored test on traumas, physical abuse, sexual abuse, emotional abuse. So whenever they have one, you get a point. And so these kids have basically four more significant traumas in their life. So there's definitely a common factor between trauma and ADHD. Sleep issues. A lot of our kids with ADHD do have sleep issues. Between 25 and 50% of parents report that their child with ADHD has trouble falling or staying asleep. So that might be something that you guys are dealing with as well. That's something that we can talk about as we talk about some of these interventions and things like that. But just know that you're not alone if you're dealing with that situation. So assessment, what does that look like? If you're doing like an ADHD assessment, typically you or a caseworker or someone provides information about the child's behavior, how that affects their life at home, social settings. Often there's some information provided from the school as well. They want to see how that's happening. Any person that's involved in your child's life may have valuable inputs. There may be a chance for them to also give input. There's a lot of different rating scales. One thing that could be interesting for you guys is finding out which scales are being used by the person who's evaluating your child, just to see what it is and do some research. But there are, I mean, I think I have 1, 2, 3, 4, 5, 6, 7, 7 listed here that are used to kind of decide whether or not a child has ADHD, the severity, those kind of things. I didn't really get into these. They're not super important. What's important is there's a formal rating scale. It's not like you go to the doctor, tell the doctor your child has behaviors, and then they say they have ADHD. Although that sometimes happens, that's not really what's supposed to happen. Okay, so we're gonna talk about treatment, and then I'm gonna talk about that book a little bit. So ADHD can be successfully managed. It's hard because it kind of like a child who's on the spectrum, their brain is completely different. And so it's hard to manage it successfully all the time. It just takes parenting completely differently a little bit. So here's like the recommendations from, like the CDC and the APA, all those people. It's recommended that children over the age of 6 receive treatment that includes medication and behavioral therapy. So both of those. Under age of 6, behavioral therapy is recommended as a treatment without medication. So medications with ADHD, it's one of those disorders that medications seem to be really helpful. I will say a couple things here. So ADHD has been managed with meds for over 40 years. About 43% of our kids with ADHD are treated with meds alone. And there are 2 types of medications to treat ADHD. When it comes to medications, they work. Sometimes it's a difficult process to find one that works. And then sometimes they stop working. So the medication thing is very useful and helpful, but it's not a one-time solution. You're going to have to continue to work with the doctor, especially with kids, because they wear off, and finding times, and should you get the longer release. So I'm just going to kind of do a short overview, but stimulant medication is one of the categories. It's the most commonly used. Some of the newer ones are a sustained release, so they release over time. These target I don't know, I can't say that word tonight, so I'm not going to do it, and dopamine. So these chemicals in your brain, they play a role in motivation, emotional responses, and movement. So they're short acting or long acting, but stimulant medications are probably the most research of all types of medications. They've been around for a really long time. So you may have heard of some of these. I'm probably not going to say them all out loud because there's long names, but I put the name of the actual medication, and then the names you've probably heard of are in the parentheses. So things like Ritalin, methylene Concerta, Focalin. I've not heard of these, but they're just amphetamine, which you probably have heard of. Adderall, you've heard of. Some of these Dexedrine, Placenta, you've probably heard of. Vyvanse is a newer one that they've been using a lot. I think this is a newer one, but I've not heard of it. So those are your stimulant medications. You would think that stimulants would actually, make our kids more revved up, but because of how their brains work, they don't. They're typically calming. One thing with stimulants is they do wear off, and so at school sometimes it'll wear off at like noon or 1, or they'll wear off right after school, and that's when they start being a little more agitated again. So finding the right schedule is really hard. And the other thing is the sleep issue. Sometimes stimulants make our kids really struggle with sleep. So, and I'll talk about some other side effects actually. I forgot I had a slide on that. Okay, so non-stimulants. So some kids and individuals don't respond to stimulants, so they can use these. So stimulants, they work just like that. Like you take an Adderall, you would feel it immediately, or it would help a child immediately. These are more like antidepressants or medications that get into your system, so they could take 4 to 6 weeks to work. So that can be frustrating when you're starting a medication. Some of these are Strattera. I've not heard of that one. 10X and Intuniv, though, we have heard of those probably. And then Capve, you guys have probably heard of those. Some of them can start to work more quickly. They just don't take full effect for that longer period of time. There is, people have had concerns about ADHD medications and substance abuse. This has been researched. They have a long history of being safe and effective. The research shows us that if kids consistently take their medication like they're supposed to, they don't have a higher risk essentially for substance abuse. Now, we do have kids who have trauma and other issues, and those do raise your risk. So if there may be things that are added to this mix that make them have a higher risk as well. So there are some side effects, especially with the stimulants. One that we see a lot is the appetite suppression. They don't want to eat. So that's something to keep in mind. The sleep thing is a big one. Normal side effects, abdominal pain, headaches, nausea. If you see things like growth suppression or weight increase, that's something to talk to the doctor about, or tics, to kind of find about if another medicine might work a little bit better. But typically medications can, I think what medications can do in terms of ADHD is kind of get the child to a level where some things like behavioral therapy do start to work. So the first line of treatment with younger children is behavioral therapy. It's found to be more effective than meds alone. So pairing it with meds can be really helpful. A lot of times the clinician works with the child to learn new behaviors that replace, the problem behaviors. Working on social skills and expressing feelings is really big deal. This is what our kids struggle with a lot. And then if parents participate as well, and then learn how to teach and guide kids in managing the behavior, that can really help, because therapists are with our kids an hour a week, if that. So if we can kind of be reinforcing those skills, that can help a ton. So there's several behavior therapy programs that are meant just for kids with ADHD. So there are these programs: the positive parenting, incredible years, parent-child interaction therapy, and New Forest parenting program. So positive parenting program is designed to treat behavioral and emotional problems in kids and teens. It combines elements of different kinds of therapies and learning. So there's separate programs for kids under 12 and then kids older than 12. They call it the Triple P program. So I looked around, they do have it in certain areas. I probably couldn't find all the areas, but in Garden City, they have it. They have it in Sedgwick County. In Junction City, they have it. There's a website. Again, if you guys are interested in the end, I can send you my references or also this presentation, and you can look it up and see if that's something that you're eligible or your child's eligible to be in that might be helpful. So the Incredible Years Parenting Program, again, this focuses more on parent competencies, so getting the parent involved to help promote social, emotional, and academic skills, and helping kind of reduce some of that problem behavior. Birth to the age of 12, and they have a website, and I think they are starting to work on an online program so that it can all be done online and self-paced. So you might keep an eye out for that. So parent-child interaction therapy, PCIT, is a kind of therapy that addresses kids who have behaviors, but it also places an emphasis on the parent-child relationship. So in this one, kids and parents are treated together with the therapist helping coach the parent and using some of these skills they teach them. So there is KCPCIT in Kansas City. Bert Nash has a PCIT practitioner in Lawrence. The Layton Center has a practitioner as well. This is a good kind of therapy, not just for ADHD, but for kids who have a lot of behaviors. And so I would look into this, especially if it's something that can get covered with Kin Care or anything like that. So it's a really a newer kind of therapy that has a lot of good things coming out of it. So New Forest Parenting Program. This is specifically for ADHD. This is kind of like some psychoeducation for parents, but also some strategies, some practical things. This takes place in the home over 8 weeks. ADHD kids between 3 and 11. They have an online site as well. So any of those things could be and might be helpful for you if you're interested in looking at them more. So ADHD in school. A lot of our kids really struggle at school because of their ADHD. Just a brief overview to let you know, and most of you may know this or may not, I don't know, that they can get some accommodations. Now, this might be tricky with kids in care and having their parents ensure that they ask for these or getting an educational person who can ask for that in lieu of the parents if they're not involved. But Individuals with Disabilities in Education and Inclusion Act, IDEA, basically states that our kids who have disabilities still get the education they need. and federal funding pays for that. So there has to be evidence that their symptoms of ADHD have a negative impact on any sort of their performance in school, including academic, behavioral, or social performance, which typically, once they have that diagnosis, a lot of those things can be tied to that. So in that case, you would want to probably get with the school and formalize an education IEP, which is an individualized education plan. Again, like I said, that can be tricky in foster care, making sure that that happens, or making sure that those IEPs are being followed. But it would really be helpful for our kids who might need, especially if the learning disorder is also co-occurring, making sure that they get extra minutes with a para or someone who can help them, making sure that certain things are happening. Some of the accommodations that could be helpful, like written instructions they can look back at, because they constantly kind of forget about what the oral instructions are. Maybe having a quiet area for working, because they can't be around other students with distractions. Seating at the front of class so they don't have kids in front of them. Having extra time on tests, especially if they've got a co-occurring learning disorder. Having the teacher or para provide prompts for desired behaviors, because they need that extra, some of that extra stuff, and time. So, yeah, that's something to consider for sure if you have a child who has ADHD. Okay. So I really want to just spend a little bit of time. I wish I could spend more time talking about this book, because I've had it for a while, and then I started reading it, a couple weeks ago after I had started this presentation, and would have included more. So this book is called Scattered Minds, The Origins and Healing of Attention Deficit Disorder. It's by Gabor Mate. He's a well-respected doctor, I think, therapist, or he's in the healing field. And he's written multiple books, but this one specifically is about ADHD, gives you an idea of what it looks like to have ADHD. He uses some personal anecdotes. He has ADHD, he has 2 children with ADHD, but then he also gives some ideas for how to address some behaviors in a non-conventional way, maybe. So I do recommend that for anyone who is interested. Maybe get it from your library or do an audiobook. So I'm just going to include a couple things that he says, and then I think we have a quick video, then we'll be done here. So he talks about how self-regulation is the goal of the development of ADHD. The fundamental impairment of ADHD is not having self-regulation, right? Because the impulsivity and all of that. So he talks about how a child with ADHD is super insecure, and they really are. They're insecure because they don't have self-control. They're not able to maintain a steady and functioning environment because their internal states are not steady and functioning. So constantly being in this chaotic environment is very overwhelming for them, even though it feels like they create it. There's a lot of shame that goes along with ADHD as well. You can kind of see that when you correct a child who has ADHD, or redirect a child who has ADHD. So that kind of just continues this cycle of parenting, redirecting. They have shame, they act out. He talks a lot about that. One of the things that I really wanted to bring up is this counter will, because I see it a lot. I think you guys have kids that fall in this category. So a child's oppositionality is not an expression of will, it's an absence of will. So basically, let's see if he talks about it. Okay, so essentially, they're not able to regulate themselves. That's an absence of will. So if you say, I need you to do your math, and they say, I'm not doing it. No, that is them not being able to stop themselves from saying that. So if they had willpower, they would do the math. So it's interesting to think about it in that way. It's like an autopilot response. I need you to get off the video game. No, I'm gonna play one more level. Like it just constantly happens. So when they do that, that allows the adult to react, but not really to act from a place of decision making, because here we go again with you have to do your math. It's necessary. Or no, we've talked about the video games. So counter will is an automatic resistance put up by a human being. So counter will is these statements that our kids make. I don't want to. You can't make me. You're not the boss of me. Just reactions that they have. They're not thinking. They're just kind of on autopilot. So it's expressed through passivity. Also, so sometimes they're not statements, but it's like, let's all go get in the car, like I talked about earlier, and the child is like just puttering around and not getting in the car. So we see a lot of this counter will with our kids. It's very frustrating. Like, what do? We can't not have consequences, right? Because that just makes it worse. Well, like we just feel like we're at a lose-lose situation. So he has a chapter on diffusing counter will, which is helpful. So parents and caregivers are unaware of how it works. They see a lot of oppositionality from the child, a deliberate challenge. Typically a power struggle ensues. It's really hard not to get into a power struggle. So one of the things he talks about is keeping attachment foremost. This is tricky with foster kids because you have to build that attachment first because you don't have that natural attachment. But counter will is increased when the child's attachment, when the child's attachment to the parent worsens, and decreases when the bond improves. So if you have a strong attachment with your child, some of those behaviors will lessen. So also not mistaking acquiescence for voluntary good behavior. So sometimes when they're compliant, that may not mean effective or wise parenting. Sometimes that's more fear-based, and it's just going to come out later. So just making sure that you're being aware of the signs and what's really going on. Not taking the child's defiance personally, which is really hard because it happens. It's like the same arguments and things happen over and over. But if we don't take it personally, they may not participate in this cycle of pressure, counter will, greater pressure, greater counter will, like this just build up, build up, build up. So also making room for some resistance in the relationship. Like if we just know that kids with ADHD are going to have this opposition and anticipate it, sometimes that can be helpful. This is a really helpful one that I've seen work better is encouraging verbal expression. So instead of trying to overcome the child's counter will, help them find more accessible ways of expressing the resistance. So if a kid gets very upset and doesn't do what you ask and starts throwing a fit, you can help them do that in a more productive way. Listen, I can see that you didn't feel like doing what I said today. Next time, I'd like you to say that with your words instead of, throwing a fit or refusing to do it. Not using insulting words. I'm tired. I don't feel like doing this. Okay, that's like a good start. You still might have to do it, but maybe we can take a little break. You know what I mean? Giving them the power and control to state their thoughts and feelings without having large fits. Men fix fences after the fact. This is kind of that relationship building thing. So inevitably, we all like get into that power struggle. Like we're tired, we've dealt with this, we've asked this child not to do this. This child's talked back like 17 times. So we react, we're frustrated. But we can kind of pull the child aside later and say, listen, that situation did get kind of crazy. And maybe I also got kind of upset. Maybe my words weren't the best. And the reason I got upset was because of this and this. And maybe you're upset because of this. So kind of mending fences, debriefing, talking about things without raising emotions. And then encouraging self-discipline instead of controlling the child. This is like the hardest. But the whole issue here is not to control the child, but to promote the child's development. So it's kind of like with ADHD, the child can't control much of anything. They have a lot of impulses, they're always stuck in their head. And what we're trying to do is control the things around them. But in this book, what he talks about is what's really important is helping them start to be able to control those things. That's the big picture. And so he talks about that in subsequent chapters, which I just couldn't get to adding into this presentation. I'd really recommend it. If you have a child who has a lot of behaviors with ADHD, or if you work with children on a regular basis, even if you start getting lost in the first couple chapters, I think I tried to read it and I was like, I don't have ADHD, so I don't feel like this is a lot. Like start skipping to the chapters where he starts telling you how things can help. I think that would be helpful for you. So I've got one more video from this guy that talked earlier. It's pretty short about why punishments don't work, and he'll talk about what he means by that. He doesn't mean not to punish. He has some different ideas.
Hey parents, do you find you punish your son or daughter repeatedly and it doesn't seem to make a difference? I'm going to explain why punishments don't work and what you should do instead. Listen in again. Hi, I'm Ryan, ADHD dude, and this is my dog Flora. So if you find that you're always punishing your son or daughter, it doesn't seem to make a difference and they keep doing the same things over and over, well, there's a few reasons for that. One reason can be they have difficulty with what's called episodic memory, which is how we recall past experiences and emotions from past experiences and apply that information to the present or the future. The other thing to keep in mind as well, that kids with ADHD have difficulty with what's called future thinking skills. So when you say things like think before you act, that is completely useless to them. Please don't say it, because if they could think before they acted, they would. The other reason why punishments seem to not work is because kids with ADHD become punishment adverse, meaning they get punished so much that they become desensitized to it. It doesn't mean anything to them after a while. And I want to be really clear. I am not anti-punishment. I am anti-useless punishment. So let's look at it this way, okay? What I think is more important is that you teach kids how to take accountability for themselves, what I call cleaning it up. So for instance, if your son or daughter does something hurtful or disrespectful, I prefer they are accountable for it by cleaning it up, by doing something nice for somebody else, okay, rather than just punishing them. Because when you just punish them, there's no accountability to anybody else. They don't have to do anything. They just have to sit there and be punished, okay? So I teach this concept of cleaning it up in Scaffolding Better Behavior and Self-Confidence, my parent behavior management training at the ADHD Dude membership site. Here's what I explain to parents my position on punishments are. I believe consequences are okay when there's a consequence for something in real life. Then I think it's okay to have a consequence at home. But other than that, if we're just kind of imposing useless punishments and not helping kids take accountability for themselves or do something to give back to others, you're kind of wasting your time, I think, okay? So focus on the cleaning it up. Give consequences when there is a consequence warranted, outside your home for that in real life. The last thing I want to mention is I hear talk sometimes about kids with ADHD should never be punished. I don't agree with that because that's not the way the real world works. And I think you're actually doing a disservice if you teach your kids that there are no ramifications for anything in real life, okay? But again, we want to focus on the cleanup, teaching them to be accountable to others, and teaching them to do a nice action for somebody else to help clean things up, okay? Please visit the ADHD Dude membership site to learn. Hey, parent.
Yeah, so some ideas there. Here's some references that go a little deeper into some of the things I talked about. I'm glad to send those to you guys. Let me stop this here.